Well, the latest on the pandemic now and the lasting impact of long COVID, which is typically defined as symptoms experienced a month or more post-infection that can just not be explained by another medical issue. In a coronavirus crisis hearing on Capitol Hill, one advocate for long haulers estimated that Americans with long COVID lost about $230 billion a year in earnings, a number that she thinks could nearly double by 2030 if the population just keeps growing. Let's bring in ABC News senior national policy correspondent Ann Flaherty for more on this. So, Ann, what stood out to you during this hearing?
So one big headline, Kira, is just how absolutely prevalent this is. We're talking about out of everyone who has had COVID, which is most everyone you seem to know, they're estimating about 1 in 5 people are experiencing symptoms a month or more later that they can't explain through another medical diagnosis. So that obviously is going to impact a very large portion of the workforce. The other big headline from this hearing was that doctors still don't know what causes it, and they don't know exactly who is mostly at risk. So they know the higher the viral load, the more likely you are to experience long COVID. So people who aren't vaccinated, people who spend long times in the hospital, more at risk. But at the same time, even young people are getting it. We're seeing college students with it. We're seeing younger people with it who didn't previously have concerning health conditions. So that's what's really alarming doctors right now.
So there's no test that doctors can give to confirm a patient has long COVID, right? So how can an employer or doctor actually determine someone is experiencing these symptoms of long COVID? And does the American Disability Act even protect workers with long COVID?
So it does. The American Disability Act HHS says that this must be applied to long COVID, and employers must find accommodations for people who are suffering from this. But of course, the problem, Kira, that these doctors say patients are going through is that they can't always prove that they have it. And a lot of times these disability claims are denied. So I spoke with one doctor after the hearing, Dr. Verduzco Gutierrez, who said that she runs these clinics in San Antonio, Texas. She says that probably only about 10% of her patients get these disability claims approved. It's very, very difficult, especially you consider that most people aren't even getting PCR tests anymore. We're doing rapid tests at home and we're self-isolating, and then a month later we might still have symptoms. So it becomes very difficult to go back and to diagnose it. The other thing she told me is that her patients are looking at about a 6-month wait list to get into her clinics. It's not a 15-minute appointment. You have to come in, you have to have several tests run. They need to rule out other medical diagnoses before they can diagnose you with long COVID.
And then you have a lot of frontline workers who are experiencing long COVID symptoms, and they can't stand for long periods of time. So what does that mean for the workforce and other frontline workers? And what does that show about the impact that COVID has had on so many Americans?
Well, this is an alarming concern that economists and the Labor Department is actually looking into this, because this could really actually hurt the economy. So what they're telling people is that if you do suspect that you have long COVID, work toward that diagnosis and seek out help with your employer. See if they can provide any kind of accommodation, because there is a big concern that nurses, teachers, others won't be able to do their jobs.
All right, Ann Flaherty. It's a lot to take on, that's for sure. It impacts all of us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.